Hi everyone, I'm back and I'm being joined by the Medical Director of Clinica Tambre, Dr. Garcia tonight. We're going to talk about IUI versus IVF and here she is, so we can start. And Clinica Tambre are very, very generously giving a complimentary round of IVF as part of our fertility clinics versus COVID. So she should be joining any minute. If you haven't applied, it ends on Wednesday next week, so please do so through the Fertility Help Hub website, www.fertilityhelphub.com. The link is in the bio. You can find out all about the terms and what's on offer from each clinic there. So let's see what's happening. Okay. Sorry, Instagram's being a bit strange tonight. Bear with us. Okay, hopefully this will work. I know that Holly was just asking about IUI versus IVF and not necessarily being suggested IUI before IVF. So that's something that we should definitely ask Dr. Garcia about. It's a great topic. Can everyone hear me? Don't know. Sorry, we're having a few connection errors. I don't know why it's doing this. It's saying that they're unable to join. Why is Instagram doing this? Okay, you can hear me. Good. Sorry, this is really annoying because we really want to chat. Let me try again. This hasn't happened for ages. I don't know what it's doing. Oh, there! Great! Good evening.
Hello. Good evening. How are you doing?
I'm well, thanks. How are you?
Very well. Sorry for the problems, technical problems.
No, it always happens. And I just noticed that Instagram has now announced that you can have 3 people on a live. So maybe that's why it's gone funny. I don't know.
Yeah.
Anyway.
So thanks for your time and thanks for sharing this, video with us.
Absolutely. So first of all, just for those who have joined, thank you for joining. And I've obviously mentioned that Clinica Tambre are so generously part of our global initiative, Fertility Clinics versus COVID, and kindly giving away a round of IVF. So thank you so much for being part of this campaign to help those we can. And as I mentioned, if you haven't applied already and you'd like to, wherever you live in the world, please do so through the link in our bio. Oh, she's frozen. Hang on, what's happening? Am I still live? Something's happened. Maybe it's the internet. We'll see. Sorry, everyone. We will get it back. Can you still hear me? Oh, someone said, where's the link? Okay, go to fertilityhelphub.com. I'm live, she's gone. Okay, we're going to sort this. Let's see what we can do. Go over to fertilityhelphub.com and you will find it there. Let me try again. Here we go. Maybe it's internet, not sure. Hi to those who are joining. We're just having issues. You're back.
I'm here.
You're here, great. You're frozen on my screen, so I don't know whether other people can see you, but we can hear you.
That's perfect.
Okay, so yes, thank you for being part of the initiative, and I'm excited to speak to you tonight because we're going to talk about IUI versus IVF. And we already have had someone saying, their specialist recommended IVF straight away. So please, can you tell us a little bit more about, ICSI versus IUI. Let's start with IUI, IVF, and then why ICSI versus IVF, if you don't mind.
Okay, so IUI is, the less invasive technique that we offer to our patients. And it is, a very good technique, but mainly the objective is women less than 38 years old. They don't have like a long time of sterility. Perhaps they are women without a male partner, or perhaps they only have like ovarian dysovulation in terms of, they don't have regular periods. By contrast, if our patient is having a long time of sterility and really has, more than 38 years old, or any other issue that could affect quality of eggs, such as endometriosis, we would have more likely to go directly with IVF, because IVF, it's not only that is a technique that will give us more success rates, but also it is a technique that will really do the diagnostic of what's happening internally. Because IUI is something that we're not going to know why it's not happening, because everything should happen naturally inside the tubes and regarding, the egg sperm. By contrast with the IVF, talking about traditional IVF or ICSI procedure, we will be able to see during the laboratory what's happening, if we have like a bad quality of the eggs, or a poor ovarian response, or bad quality of the embryos.
Yes, so you've got more to work off if people have an IVF cycle.
Correct. So it's more like the double the pregnancy rates we can offer IVF compared to IUI. And also it's only one attempt. By contrast, normally IVF, if we can freeze more embryos, the probability cumulative pregnancy rate will be even higher than the double.
Yeah, that makes sense. And is it common that sometimes people might go through IVF and then they might go back to trying IUI again? Does that ever happen? Because people might feel like it's a step backwards, but maybe that's not always the case.
We do not recommend, when there is really the indication, to go directly to in vitro process, and if we have not been successful, to move step back. It's not really recommended, because it's only in very little cases where, imagine, you really have a very poor ovarian reserve, and during IVF we have only one follicle, and you explain that patient in particular what is, the possibilities with that cycle. And there is always the possibility to change to IUI.
Yep.
But it is not recommended at all.
Okay. And I guess for someone like me, because I wasn't recommended IUI, because I was having treatment in the States, and due to time, etc. But I was in my early 30s, and it was male factor infertility. So for a situation like that, would you normally recommend the woman tries IUI first, if it is male factor, to have less drugs and not to have to go through the full IVF procedure?
In that case in particular, if it is considered a male factor, we will need to understand what type of male factor is. If it is, a male factor, that we can go ahead with IUI, or if by contrast it's much better to go directly to IVF.
Sorry, my situation was with donor sperm, so I guess you're right. It would depend, wouldn't it, on the sperm quality, of course.
Correct, absolutely.
Someone has just asked, with IUI, is the sperm selected like IVF? With someone with low morphology and DNA fragmentation, is this why IVF was recommended?
Yeah, if we're talking about low morphology only, the main societies such as European, America, if it's only the teratozospermia, and it's not a severe teratozospermia, we can go ahead, of course, with IUI. By contrast, if it is a severe teratozospermia with 0% or 1%, it is indicated to go directly to IVF. And of course, if fragmentation is abnormal, it's absolutely compulsory to go with IVF, to be able to do techniques to process the sperm and to minimize the fragmentation in that sample in particular.
That makes sense. Thank you. And you mentioned success rates. What are the success rates of IUI versus IVF, dependent on age and various other factors?
Correct. So normally IUI, it's very, very difficult to, increase more than 25% per cycle. So this is the, maximum 25-30% in very, indicated patients where everything is absolutely fine, and the point is they don't have partners, but the age, it's absolutely okay. By contrast, IVF could really increase to 60%. Imagine if we go with IVF with PGS and we have euploid embryos.
Yeah, that makes sense. And what about IVF versus, standard IVF versus ICSI? or PICSI, as I've heard elsewhere?
Correct. So this is mainly to do with the sperm. Okay. So if the sperm is absolutely normal, we have the possibility to do 100% of the eggs with traditional IVF, or what we normally do in our clinic, it's 50% of the eggs with traditional IVF and 50% of the eggs with ICSI. So
Ah,
we are able to see what is the best behavior of that eggs, because we know IVF, traditional IVF has, best results in terms of perinatal outcome because it's less invasive, of course. By contrast, there are some couples or some, women where if the 100% of the eggs are fertilized with IVF, we wouldn't have any eggs fertilized because of receptors in the eggs. So that's very, very important to select what kind of women can go to traditional IVF or what kind of couples, because of male factors, needs to go ICSI or PICSI.
mm-hmm.
And, we try to do 50% in patients with good prognostic.
Mm-hmm. That makes sense. I believe that ICSI was used in my case because they were using frozen sperm. Why is that the case with frozen sperm?
I mean, even though you are doing with frozen sperm, you can do traditional IVF. By
Okay.
contrast, if you're taking frozen sperm or fresh sperm, you need more quantity of spermatozoa to do a traditional IVF. So, talking about donors, if we're doing traditional IVF or IUI, we need more samples, we need more concentration and more, sperms, spermatozoa. By contrast, if we're doing ICSI, as long as we will use like 8, 10, 12 eggs, we can use less quantity of sperm.
Okay. And so do you make that decision based on the number of eggs that you get from a cycle as well?
I mean, of course, if we have very little amount of eggs, it's a little bit, scary to go with traditional IVF. But by contrast, if we're talking about, advanced age or eggs that could have like not a very good quality, then we normally recommend when we're talking about second or third cycles, because we have a lot of patients that have failed in their clinics and they're coming to us to try different procedures. We try to minimize the impact in that egg to try to maximize the possibility. And
Mm-hmm.
then if the indication is well done, sometimes even though we have 3 or 4 eggs, we go with IVF. So it's very, very important to select a very good laboratory, but also to select very good experts that really understand what is the best procedure in that particular case.
Mm-hmm. And do you decide which procedure is going to be used before the egg retrieval or afterwards?
Normally, it's something that it's already told with the patient,
Okay.
during consultations.
Yeah.
By contrast, it's the last day where we really decide is the day of the egg retrieval, where normally we'll to have the fresh sample, and then biologists will decide the best procedure in that case.
Mm-hmm. Yeah, that makes sense. Someone has said that they've had 3 failed cycles. I'm so sorry. And one yielded 2 abnormal embryos and 2 had 0. They made it to blastocyst. They're changing clinics, and the doctor said to prim with omnitrope for 2 months. I don't know what that is. Do you think I'd need a third month? I think that might
I
be.
don't know as well what is omnitrope, but of course there are lots of substances such as melatonin that we
Mm-hmm.
can try to maximize the quality of the eggs. By contrast, if it is really the problem of the sperm, what we normally can realize if it is a problem from the beginning, imagine fertilization is very low or division from embryos from day 2 to day 3, it's more to do with the eggs.
Yeah.
By contrast, if it's a problem of division from day 3 to 5, it's more the sperm. So there are lots of different vitamins for men or for women that could, increase fertility and quality of their gametes, of eggs or sperm. But for ovarian quality, although there are lots of articles, there is not medical evidence that if we take, for instance, Omnitrope, that any of us know what is, we can really increase quality in that women.
Mm-hmm. That's good to know. Thank you. They've said it's a growth hormone, a human growth hormone prescribed in the US apparently. Another question. At Clinica Tambre, do you offer Zymot? And what's your opinion on this?
Sorry, can you say again?
Do you offer Zymot?
What is Zymot? Can you just...
I'm not entirely sure myself. I think, Holly, if that's you, please could you just write what it is? I think it's to do with sperm. So then we can have the question answered. And if anyone's got any questions in the meantime, please do ask.
yeah, I know. Yeah, Zymot is the chip fertile. So it's a technique that we normally use a lot in our laboratory, and it's mainly indicated for male that are having problems in the fragmentation in the sperm. Okay, you know, in the head of the spermatozoa, you have the genetic the DNA, and we can do in the fragmentation, the single and the double brain fragmentation. If there are you know, a high fragmentation, then we need to use the Zymot or chip fertile, mainly told more in Europe, in Spain. And yeah, it's absolutely a very good technique to maximize chances, because we're always like, you know, more mainly experts punishing more, you know, women and eggs quality and everything. But right now is the time to really improve quality of sperm and you know, try to increase chances in every cycle.
Absolutely. So you do offer it at Clinica Tambre then?
Yeah, we normally recommend to all patients, no matter if they are coming, you know, from abroad or from Spain, if they have failures or not. But it's mainly indicated when they have had, you know, a long time of sterility, or they have had previous failed cycles, or there is like a big consume of coffee, tea, chocolate, you know, smoking, where, you know, these are substances, external substances that could affect fragmentation in that sperm, and then perhaps we need to do this technique to improve that sperm.
I've just had a private question. Can a man dramatically change his sperm quality with supplements and giving up smoking?
I have some patients that they have really, you know, done very well, changing their lifestyle, taking turmeric for 3 months, antioxidants. So it's really amazing the changes that I've seen. Of course, I cannot say always the same, because I have some patients that have, you know, very important male factors, even though they don't smoke or they don't take a lot of coffee or tea. So then in that particular cases where I cannot really, you know, change life habits, lifestyle, sometimes I say, okay, let's try, of course, 3 months of turmeric and change a little bit lifestyle, but then we need to repeat this fragmentation test. But majority of my patients, they improve a lot.
That's good to know. In fact, you wrote a brilliant article for Fertility Help Hub around male fertility and male infertility, and tips for helping improve sperm holistically. So if people head to the website, then you can read that. Just type in Clinica Tambre in Fertility Help Hub and you'll get that. Are there any other questions whilst we've got Dr. Garcia on the line, if you like, at the moment? I'm just trying to think whether there's anything else you'd like to cover in terms of IVF or IUI or ICSI?
So regarding IVF or ICSI, it's more to do with the expert, you know, and that case in particular, what is more recommended. And regarding IUI or IVF, imagine you're a woman or a couple that you can really go directly to IUI or IVF. I think it's very important to talk with that couple in particular, and also explain the emotional aspects, financial aspects, because it is completely different if we go ahead with IUI or IVF. Of course, what we want as a clinic is to maximize, you know, healthy baby in the first attempt. So right now that we are, you know, a very difficult society, sometimes going ahead with treatments that they do not have like a very good prognostic, not because that women in particular, but because of the treatment, it could be frustrating. So it's very important to understand possibilities that can offer IUI or IVF and decide together with that woman or a couple.
Mm-hmm. That's really useful to know. Thank you. This is off topic, but it's about the COVID vaccine. So someone who's had the COVID vaccine today, hoping to do IVF again in the summer, do you think this will be okay?
Yeah, of course, absolutely. So evidence is not saying you cannot have a pregnancy at all because it's absolutely risky. By contrast, evidence it's very low and recommendation to wait at least 2 weeks after the second injection. So that would be absolutely great.
Okay, that's really good to know. Are you seeing patients at the moment who are nervous about having the vaccine?
Yeah, we have a lot of, calls and
Mm-hmm.
emails. What I need to do because, normally in the UK, you have majority of your population of our age that are starting to have the vaccine. Here in Spain, it's more to do with specific, sectors of our society, such as nurses or doctors, whatever. So we try to talk directly individually with that women in particular and decide together if do the vaccine and postpone the treatment or by contrast do the treatment before.
Mm-hmm. Yeah, that makes sense. Thank you so much. And the last question I want to know more about if you have time, is ICSI versus PICSI. What do they both stand for and what's the difference between the two? Because I only recently heard of PICSI.
Yeah, so ICSI is the intracellular sperm injection, which is completely different to IVF traditional. So embryologists will select the best sperm, the best spermatozoa, and will do the fertilization directly to that egg in particular. So PICSI is a specific type of ICSI. For
Okay.
ICSI, we have different techniques, and every clinic, every single clinic selects the best, technique depending on each case. So PICSI is a specific ICSI procedure,
Okay. Makes sense.
such as IMSI or any other selection.
Mm-hmm.
Sperm slow, so it is more to do with specific cases and also with specific diagnostic that that clinic in particular is doing. Normally right now what we are doing is this chip fertile, the fragmentation test to our patients because we're having good, very good results, and if definitely they need to do this chip fertile, that's how we're doing this selection of spermatozoa.
Great. Thank you for explaining that. Do you offer, and are you still offering steroids and intralipids at this time?
Yeah, of course. So as long as we know that immunology in reproductive treatments, it's not 100% evidence-based, we have a lot of patients having lots of failures, even with egg donation or double donation or with euploid embryos, and the only thing we can offer is immunologist. And we have very good experts in our clinic. Dr. Hill, she's one of the best in Spain regarding this field, and it's absolutely necessary for people that is having an implantation failure for a long time or repeated miscarriages. It's absolutely necessary to do a very good diagnostic and understand if it's necessary intralipids or prednisone or infusions, whatever.
Yeah. Thank you for answering that. Do you have time for one more question?
Sure.
So someone's just said that they've sadly just had a failed IVF cycle. They retrieved 13 eggs, 5 fertilized, 1 embryo made it to day 3. Would you this suggest to you poor egg quality or sperm quality or both?
It's mainly poor quality because you're telling me that you had a lot of eggs. By contrast, fertilization was less than 80%. That normally, to statistically speaking, we need to have like 80% or 70%, and in that women it was less, and only 1 embryo day 3. It's very bad because normally we should have at least the 80% as well of embryos on day 3.
Right.
So I would recommend it's more to do with eggs.
Okay. Okay. Thank you. And if anyone wants to speak to Dr. Garcia and book a consultation, you can do so through them directly, or you can come through Fertility Help Hub. I want to thank you again for everything that you do and for the free cycle you're generously giving away. Thank you so, so much. It's really going to help one person or couple around the world, and we're so, so grateful. And yeah, it's fantastic to be involved with a top clinic like yourselves in Spain. So thank you so much this evening. I'm really sorry that we can't see your face properly, but we've made it work, and I hope that it's been helpful for those who have been watching. So thank you so much for your time.
So thanks a lot. Take care and stay safe.
You too. Speak to you soon. Bye bye, everyone. Thanks for joining.
Bye.
Bye.